faces a possible death penalty. Full report on this morning next hour. Coming up next, new developments in the case of a prominent doctor found dead inside her home. Investigators say this does not look like an accident.
Do you mind if we just turn that down for a moment?
Oh, sure.
Let's see, I'm just going to mute it. There we go. Candy, this is Ann. She'll be your nurse this evening till 3. We're just going to give a quick handoff report. Let's see. So here we have Candace Kane. She goes by Candy, 87-year-old female, patient of Dr. Corey. The hospitalist consult. She came in on the 3rd. DNR, DNI. She fell, comes from Horizons, fell, fractured her right hip, had an ORAF with pin placement on the 3rd. So she's post-op day 4. She had spinal anesthesia with a femoral nerve block. Past medical history includes cervical and lumbar spinal stenosis, Parkinson's, hypertension, hyperlipidemia, chronic edema, constipation, urgent incontinence, allergies to penicillin and sulfa. Over here she's got her IV Levaquin running, new diagnosis of pneumonia, that's just started today. Tubing's current. PCA has been DC'd a couple days now. Foley came up yesterday.
Okay, Nicole.
She's got SCDs on, she's receiving Lovenox, which she got today, and her TEDs are on.
Good.
She is on telemetry. Her box number is 6785.
Okay, got it.
Oxygen, she is on 2.5 liters currently.
Okay, good.
Suction is set up. And her bed alarm, oops. I guess it's her. She should have her bed alarm on. She has a fall risk. Good. Assessment-wise, neuro, she's got a slight essential tremor of her right hand from her Parkinson's. Cardiac, she was a little tacky this morning, heart rate 105, 115. That's why she's on telemetry. I put it on just to see. She was in a sinus tag. That has improved since her morning meds. She's got 1+ bilateral pedal edema. That's chronic. She had her Lasix this morning. Respiratory has been her issue today. Breathing is shallow. This morning when she woke up, we're set with 79% on 2 liters. So I bumped her up to 4. She got a neb. She improved to 94%. I've since weaned her back down to 2.5 liters, but just needs frequent reminders for the incentive spirometer, deep breathing.
Okay, you got that.
She's been working on that. GI, her last bowel was on the 3rd, pre-op. She got cholestatic lactulose this morning.
Good stuff.
Yeah, good bowel sounds, passing gas, abdomen soft. She probably need a suppository if no results this evening.
Okay, we'll check back tonight on that.
As I told you, Foley came out last night about 10 p.m. She had a 1 incontinent void this morning about 6:30. Bladder scan after that was unremarkable. She has not voided since though. So I bladder scanned her at 1:30 when she got back to bed.
Okay.
After lunch, showed 105 cc's. I think she's dry. She's not drinking a whole lot, so
Okay, so we'll
keep an eye on that.
Right.
CSMs are fine. She has a soft collar there that she wears with positioning in bed or transfer to the chair because of her spinal stenosis. Skin, Dr. Corey came in and changed that dressing.
We'll just peek at it. Can you look at that dressing? Thanks.
Dr. Corey changed it this morning. She removed the old dressing, put those 2 new Mepalex on.
Looks good.
No new drainage, staples are intact, incision looked good.
Okay.
Pain, she's denied pain for me, but I gave her tramadol this morning with her morning pills. Plus she got scheduled Tylenol at 1300 today.
Okay.
She is sensitive to narcotics. She had a dose of oxycodone post-op that made her quite drowsy and sedated, so we're avoiding that.
We'll keep an eye on that.
Yeah. Labs, her H&H this morning, 7.1 and 22, down from 7.3 and 22. No plan for transfusion unless her hemoglobin drops below 7. And Dr. Corey is aware of her labs this morning.
Okay.
BUN was 26, creatinine 1.01, and her INR was 1. She did have a repeat chest x-ray this morning because of her increased O2 requirement, low grade temp. Showed an early infiltrate, so they were treating her for pneumonia.
Okay.
And that's the Levaquin that's running now.
Good.
The only other thing, her blood pressure was high this morning, 174/91. After her morning catapress and Lasix, she dropped to 98/68. Dr. LeBand's aware of that. She was asymptomatic, but just keep an eye on.
Alright.
Plan for tomorrow, going to recheck her labs, the CDC and BMET in the morning. Dr. Corey changed her DVT prophylaxis. She was on Coumadin. She's now on Lovenox, and she got the first dose this morning. And that's
I'll
a daily
give her a
thing.
sheet on the Lovenox, or have
Yes, that would be good. I did not
Okay.
get to that.
So we'll give you some info on Lovenox,
Yeah.
what
Big-
that is.
big picture, the plan is for her to return to Horizons for rehab and then transition back to long-term care there. Her husband and daughter were in this morning, and Dr. Levan talked to them, so they're all up on everything. Quick peek at the Med Act.
We're looking at your plan right now of what we do.
You doing okay on pain still?
How's your pain? What number would you give it?
It's not too bad, maybe a 3.
Okay, let me know if it goes above that.
Okay.
We can get you something.
She is 50% weight bearing on that right leg. We, per PT's recommendation, using the Hoyer, which she tolerates fine.
Okay.
Regular lactose-free diet. Hospital's consult. SCDs are on, TEDs are on.
CDs, TEDs, yeah, I saw those.
Talked about the bowel movement and avoiding.
Right, we'll work on that.
CBC will be met in the morning. She got PTOT ordered, her Tim's barometer, Pure and Nebs, her last one was this morning.
Okay.
She is a fall risk, which we talked about. Q4 vitals, CSMs look good, dressing looks good.
Okay.
That's all we got.
Alrighty.
Candy, do you have any questions?
No?
No? Doing okay?
Yeah.
So I'll be back in later,
Okay.
do some more assessing, and you'll see me till 3 a.m.
Okay.
And I'll be back